For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman, and I hope you are A-OK. We're here at the Radiosurgery Hour. We're here talking about how to have a better life, how to live better, how to live longer, how to be healthier, how to have better cancer treatment and medical treatment. So if you have questions, please call us. We're at the WOR studio. Bob and Ed are running the show, who are fantastic. And we're here to take your calls. There's lots to talk about today, so I don't want to hesitate. If you have questions, our number is 1-800-321-0710, 1-800-321-0710. That's the number for the hour if you have questions. So I want to jump in and talk about a lot of different things today. The first patient I want to talk about is a man who came. He's a 60-year-old man with AIDS. He has AIDS and hepatitis C. Well, you can say, wow, he's a sick guy. But no, he's a biker. He's an athlete. He's really been very, very healthy. And he came to us. He was referred by his doctor because of severe hip pain. And actually, we did a scan on him and found a mass eating through the hip bone. The mass, now, if you ever spend time in Chicago, there's something called a Chicago softball, which is bigger than a normal softball, baseball softball, but smaller than a soccer ball, if you have that in mind. Well, this mass was about the size of a Chicago softball, eating through the bone. The man was in intractable pain. Finally, he got sent to us, and we immediately, this pain was not relieved by narcotics, by the way. He's taking all kinds of pain medicines. It just wasn't helping because the cancer was eating through the nerves, eating through the bone. This is the kind of work we do. And we do it with focused treatment. So with radiosurgery, we're able to hit the cancer, not hurt healthy tissues. The immediate surrounding tissues are tissues like the rectum, the colon, the intestines, the small bowel, the bladder. No, you don't want those things radiated. You want the cancer radiated. And with radiosurgery, we can just hit it in a few treatments, and the success rate's very high. Actually, we've looked at our data, and it's about 90% for metastatic liver cancer treated with radiosurgery. So this man most likely is going to do great. He had his first treatment Friday, just before the weekend, and he's going to get treated again on Monday. And I will report back to you on how he's doing, but most probably, and that's the beautiful thing about radiosurgery, is most probably we have good news to report to him, and we can have good results, therefore, reported to you, which we will do as the time goes on. There's an article in the Dow Jones this week talking about Medicare reducing hospital payments. Well, Medicare is like the government insurance plan for certain Americans. They're going to cut payments to hospitals to 2,610 hospitals, 3/4 of the hospitals eligible, because too many patients are getting readmitted within 30 days. So what they're doing, Medicare's doing, is if you're hospitalized, they'll pay for that hospitalization, most likely, hopefully. But if you get readmitted for a complication within 30 days, whoops, they're going to take it as a penalty against the hospitals. Now, these hospitals that are getting penalized include top academic hospitals, even small regional hospitals. They're going to get reduced payment for every beneficiary they treat from October 1st through September 30th next year. So what the penalty is going to be? Well, in some, it's going to be 1/100th of 1%, but 39 hospitals are going to get the maximum cut, which is 3%. And 500 hospitals are going to lose 1% of the Medicare payments for everything they do. And Medicare is going to save about $428 million. This is a way of telling hospitals, don't get people in and out before they're ready to go home. Sometimes hospitals, as many of you know, send people home before they're ready. Of course, I would say it's better not to be in the hospital. Our treatment is all outpatient. You sleep in your own bed every night. And outpatient means you're not exposed to all those germs and bugs and noisy corridors and all the other things that one associates with a hospital. Now, of course, there's some good things in the hospital. And as Eisenhower said about Nixon, give me a week to think about what they are. We had a man who called me, innumerable times last weekend. He and his father called. He's a 44-year-old man. He came in this week. He's married. He has 2 children. He came in for a consultation of a 7-centimeter mass in his pancreas. Last Saturday, just 1 week ago, he was having back pain and abdominal pain. He went to the emergency room. They did a CT scan, and they found a 7.5-centimeter mass in his pancreas, in the body and the tail of the pancreas. He went to, on Monday this week, just all fresh news, he went to a gastroenterologist for a biopsy, and the doctor said he couldn't do it. Usually gastroenterologist biopsies the pancreas. They go down the mouth into the esophagus and the stomach, and then with an ultrasound and an endoscope, put a needle into the pancreas. This doctor couldn't do it. So the man came to us, and within 24 hours he had seen me, got a full history, arranged for staging so we know exactly what's what, and got a biopsy, and got cancer markers. So we'll report back when everything comes back. I do know the cancer markers are negative, which is a plus. I do know that there's a mass that's 7.5 centimeters in the pancreas and the tail of the body and the tail of the pancreas. The man kept talking about a Whipple procedure. Well, Whipple was a physician who tried to do surgery on pancreas. So guess what the survival rate is if the surgeon goes in, does a Whipple procedure for pancreas cancer. So he goes in, he does not see any spread of the cancer, he does surgery, he or she, and what's the average survival? Well, it's only 15 months. So most probably either the cancer is not being found early enough, or the doctor is spreading the cancer when they operate, or both. So it's interesting news. This is talking about pancreas cancer. This is a 44-year-old, pretty healthy man. He's about 260 pounds, working, wife, kids, parents, loving family. And, of course, he wants the best treatment to be cancer-free. So the good news is the cancer markers are negative. The PET scan does not show any spread. We're waiting for the biopsy report, and we'll get back to you. But of concern is the fact that some people want to do surgery, and the average survival of surgery is only 15 months, whereas we're able to control pancreas cancer where we treat it, whether it's in the pancreas, liver, lymph node, with a local success rate where we treat it of about 90%. So it's quite different. Our work is all non-invasive. There's a frame that's custom-made for the patient. It's painless. There's no claustrophobia, usually just a few treatments. There's a new article in the New York Times this week written by Gretchen Reynolds, and the title is How Exercise May Protect Against Depression. So exercise is known to safeguard the mind against depression, but was never known exactly how. Now, there's a new study with mice, and there's ways that you can stress even mice. So it's not only us that are going nuts in this crazy world. Mice can be put in enclosed spaces or forced exercise, and they can actually show signs of depression. They start seeking out sugar solutions. They no longer experience normal pleasures. It's possible to stress out even mice. And the doctors made pre-exercised mice that were bred, so they have a special kind of muscle with an elevation of a certain enzyme called PGC-1 alpha. And then they tried to extrapolate to human beings. And the researchers, as Gretchen said, wrote that these findings are relevant to people. The researchers had a group of adult volunteers complete 3 weeks of frequent endurance training consisting of 40 to 50 minutes of moderate cycling or jogging. And then they did muscle biopsies before and after. And they found that after 3 weeks, the volunteer muscle cells contained more PGC-alpha, and the substance that breaks down a particular enzyme, than at the start of the study. So it suggests that if you are getting depressed and you exercise, you may be protected by exercise. So healthy news might be useful for you. What do you have to lose? Probably not too much. What do you have to gain? Probably you'll fit in your clothes better and feel better and be happier. So why not? And another patient who came in this week, a 67-year-old black man. And again, I talk about black patients with prostate cancer because we know the mortality rate is double. So this man had a tongue cancer treated in 1997, and now he was diagnosed with prostate cancer in 2012 with cancer and is yet to be treated. And that is the main issue in the black community, these long delays between diagnosis and treatment. Many people believe, many researchers believe that the long delay is causing excessive mortality. And here's a case in point. Let's learn from it. There's no reason why the black community needs twice the death rate from prostate cancer. This man has waited 2.5 years for treatment. And strange enough, listen to this. He had a biopsy in 2012. It showed cancer. And then he had a biopsy again in 2014. Why? We already knew he had cancer. They should have pushed him to get treated, or at least encouraged him to be treated and tell him what the risks are. Well, the risks are you can die, and about 70,000 men with prostate cancer die of the disease each year. So for this man, we're offering him treatment. He seems eager to get treated. Finally, came to us where he has his own doctor in a private center that answers his questions, not students, not residents, not interns. They're all great. I was a student once. I was a resident once. I was an intern once. But you may want, when you have a serious condition, to have your own doctor that you can call day or night, 24/7, and know what's going on. Someone you'll see week after week, month after month, year after year. You'll have the doctor's cell phone in a private center. Everyone knows who you are. We take Medicare, Medicaid, insurances. We take most insurances. I think it's better for the patient. And this man says, yes, he wants to finally, after 2.5 years, after getting straight answers, he wants to be treated. Thank God. We're going to stop for just a moment. We want to have some new voices talk about our work. If you have questions, you're welcome to call Bob or Ed. They're at our show. I'm Dr. Lederman from the Radiosurgery Hour. We work at Radiosurgery New York, which is at 1384 Broadway, 1384 Broadway, which is the corner of Broadway and 38th Street in Manhattan. We're very close to the subways, the trains, the buses, Penn Station, Long Island Railroad, Grand Central, all the railroads that go into Grand Central, all the buses at Port Authority, Times Square, Herald Square. I think we're the best located cancer treatment center around. I think everyone would like to be where we are, and we're happy to be so convenient to so many people. Anyway, we have a new cancer treatment center, and that's what we do. We take care of patients who have cancer or who have suspicious lumps. Give us a call. Our number during